In this video, I'll answer some of the questions you're likely to have about recovering from a partial knee replacement if your doctor has suggested getting one. This information is based on my own experience. I had partial knee replacement surgery several years ago, but also on research I've done on reliable health websites like these. First, you probably want to know how long you'd be in the hospital after the operation. It depends on such things as your general health and physical condition, but usually 1 to 3 days. I was actually able to go home the day after my surgery. After you released it, you'll need the help of a cane or walker for a while. Research I've read says you might need 2 to 3 weeks, but I was able to get around my one-story apartment pretty well in about 7 days. My experience may not be typical, though, so get your doctor's advice on this topic. My doctor told me to make sure to keep my incision dry while it healed, which takes about 2 to 3 weeks. So you shouldn't soak in a tub and definitely don't go swimming, but I was able to shower right away. For waterproofing, I cut out the bottom of a plastic grocery bag, putting it over my knee, then rolling adhesive tape around it above and below the incision. You'll experience considerable swelling around your knee immediately after your procedure. You'll need to treat it with ice packs several times a day, 20 to 30 minutes each time, for 4 weeks. Elevating the leg that's been operated on also helps. You will need physical therapy to get your knee back to normal strength and range of motion. Depending on such factors as your age, general health, and overall physical condition, you may need to work with a qualified trainer at a well-equipped rehabilitation facility several times a week for up to 3 months. The research I've read says you should allow yourself 8 weeks before you start driving again. I did it much sooner than that, about 3 weeks. But again, let your doctor be your guide, and always be careful getting behind the wheel if you're still taking something to relieve discomfort. Some people can return to work sooner than others, of course, depending on the physical demands of their occupation. Naturally, you can return to work sooner if you mostly sit at a desk. I was back at the office 9 days after my operation, but if your job requires a lot of lifting, walking, kneeling, or standing, you'll probably need advice from your doctor based on your progress. The same is true if you take part in intense, competitive sports that require biking or cycling, running, or jumping. Less demanding sports, of course, require less time and rehabilitation. Get the opinion of your doctor or physical therapist. I'm an avid long-distance walker, and I was able to do 7 to 8 mile hikes with no repercussions about 3 months after my surgery. Again, my story may not be typical, though, so get advice from people in the know. Generally speaking, normal travel on trains, buses, and planes can resume pretty quickly after your surgery. But be aware that there's a danger of a blood clot forming if you sit in one place or position too long, so be especially careful if you do a driving vacation or take a long overseas flight. Tell your doctor if you have any such plans. He or she may recommend a blood thinner to reduce the likelihood of clotting, or he or she may tell you don't. You're probably curious about going through metal detectors when you pass through airport-style security. Yes, it's possible to set off an alarm when you walk through some devices, although this has never happened to me. Nonetheless, I always mention the screeners that have had a joint replacement. I have never had to show any documentation, although my doctor gave me a special card just in case. No one has ever asked me to show it. As for cosmetic and appearance considerations, there's your scar. You will have one. My scar is a thin, pale, vertical line over my kneecap, about 7 inches long. Thanks to medical advances in surgical techniques, it's hardly noticeable from even just a few feet away. Usually the scar will have faded significantly 4 to 6 months after your procedure. Finally, what about long-term swelling, residual pain, or mobility issues? Usually I'm only aware of my partial knee replacement when I kneel or stoop, but I've read that some people occasionally experience mild discomfort, stiffness, minor swelling, or a reduced range of motion long after their operation. Again, everyone's experience varies depending on their age, general health, and physical condition.
If you found something of value in the video you just watched, I want to invite you to hit the like button and also subscribe to the Here's to Your Health channel so you'll be notified every time we publish something new and interesting. Once again, thanks for watching, and here's to your health.